So what we found was that that patients or providers did a very good job of documenting the first-degree family history. Almost 80% of the charts of breast and colon cancer patients had a first-degree family history. Only about 2/3 had a second-degree family history. And then when we looked at age at cancer diagnosis within that family history, a very important point that you need to understand for referral and consideration of genetic testing, that was documented less than 50% of the time. We found that the family histories were much more complete for the breast cancer patients than the colon cancer patients. And there was a statistically significant difference in the family history taking around breast and colon cancer patients. I think we found that with respect to first-degree family history, there's pretty good quality around that. But I think we need to do a better job, mostly around education for community oncologists about the importance of the second-degree family history and the importance of getting age at diagnosis. We also found that when we looked at who was referred for genetic counseling and genetic testing, about a little bit less than a quarter of all colon and breast cancer patients were referred. But when we looked at those who met referral guidelines, we found the numbers drop significantly, and less than half of the people who could have been referred were actually referred. Much more common for breast cancer than colon cancer. So we need some education about those referral guidelines, who's appropriate, and who could best benefit from considering genetic counseling and genetic testing. Impact is high. We know that 16% of all cancers are second primary cancers. You can use the family history to identify which patients are at higher risk for a second primary cancer, and you can intervene with additional screening and prevention options for those patients. So potentially, we could reduce mortality. When you look at cancer survivors, second primary cancers are the biggest cause of mortality for that group, while second cancers are caused not only by hereditary predisposition but therapy related. If we make an impact into identifying those patients who are at risk because of family history or genetic reasons, we can screen those patients better and offer them prevention options.